So I think the disruptive forces from a leadership perspective, we've touched on a bunch of them already today when we've talked about all the data that's out there and what people know about you as a leader and what you have available, hopefully, to bring to bear as you're making leadership decisions. We've talked about the technology side of it and how some of your employees, frankly, might actually be robots. Probably not looking like C-3PO, but some other form of technology. We've talked about all of the other aspects of technology that make information available quickly and so on, and how that's disrupting. One of the things I don't think we've spent enough time on is just how all of this digital change is actually completely disrupting the way the workforce feels and the way it interacts and the way it engages. And at the same time, the demographic overlay of that. And so we are now dealing with now, and 10 years from now, it's going to be just that much crazier. We need to think about how we are leading a workforce that is not right next door to us, but that still wants a lot of interpersonal connection. I mean, think about the Facebook example around how the people in Asia where it takes 2 hours to drive still came into the office. Think about I was actually amazed at the hackathon solution with the bunks, because my immediate answer was, well, why do you even need those people in there? I mean, they can be virtually there. But so as leaders, we really need to step up and go through 3 major shifts. Our research on leadership is telling us we've got a massive cognitive shift we need to handle. We need to think differently because there's incredible complexity. There is ambiguity, which we can't be certain about, to the Bob's point, right? We can't be certain about it, but we need to bring some clarity. And things are moving incredibly quickly. So cognitively, we need to be fast as leaders. We need to be comfortable to make decisions without all the information. We need to make an incredible behavioral shift. And that behavioral shift is even more and more going to be important around how we build relationships, how we collaborate, and how we talk and interact with people. We need to influence differently. I think this comes back a little bit to some of the dynamics around the journalists we were just talking about, and around the storytelling. So those capabilities are going to become so much more important. And then finally, I think this one's the biggest challenge, is we need to make an emotional shift where we need to react differently. We personally need to be confident and comfortable that we don't have the answers. We are not the experts, and we probably have never worked in the areas that these people are going to be working in, or the machines are going to be working in, or whoever is going to be working in 10 years from now. So we've got to have that ability to operate confidently in that world. We've also got to have this incredible ability to build connections with people, as we've just talked about. And when you get to some of the ethical things that we were, kind of been running underneath some of this dialogue, that is going to require a level of authenticity that has never, that's always been important. It's just going to become important on steroids, which means we need to be good at being vulnerable. I think that goes back to the conversation earlier this morning about trust. If we don't build that even more, we're not going to survive in this world.
How do we transition over the next 10 years to this volatile and be ready for it, and not just accept it and defend ourselves from it, but thrive in it so we can deliver good care? And so one of the strategies is, at first, we just need physicians that understand it. So much of what we do as physicians, we're trained in diagnosis and management. We're not trained on how data science works. We're certainly not trained on how medical design works. And so one of the things we've done is we've tried to encourage our young physicians to gain other skills that will prepare them for this shift and these emerging technologies. And the conversations change very quickly once you have someone that really understands informatics, data science, machine learning, about what the real capabilities are and how we can translate those to patient care.